Hello, my name's Teresa.
And I'm Deborah.
And today we're going to talk about the environment and your health. Preparation is the key. The aim is to look at how the weather affects people's health, to discuss the relationship between the weather and your lung condition, to understand the importance of looking at and understand the weather forecast, to learn ways to keep yourself well at different times of the year.
The weather forecast. Hot and cold weather alerts can be found on the Met Office website, but will also be mentioned on local and national TV and radio stations. These can also be found on smartphone devices, or if you have the facility, ask Alexa. You can also search for the Met Office website via www.metoffice.gov.uk, all lowercase.
The weather fronts. Keeping an eye on the weather fronts may be useful for people living with chronic respiratory disease. Depending where the extreme weather front comes from will determine if it's high, medium or low risk to patients in Liverpool. The map on the next slide illustrates where potential weather fronts are coming from.
So, if you think of the map as a clock, looking at 1 o'clock, this is high risk to patients living in Liverpool as the weather front is originating from Scandinavia and the North Pole. Cold air travels across bodies of water such as the North Sea, making it cold and damp. Looking at 3 o'clock, this is high risk to patients in Liverpool as it originates from Russia, Siberia and the North Pole. So it's cold and it travels across a body of water, making it colder and more damp. Looking at 5 o'clock, this is marked as high risk as it originates from the north coast of Africa and Sahara Desert, which are both very hot. It crosses over the English Channel, which is a relatively small body of water, so it does not have the chance to cool down, resulting in a dry heat similar to your central heating at home.
Looking at 7 o'clock, this is medium risk. It comes from the north coast of Africa, so it travels across the Atlantic Ocean, a vast body of water. So this gets the chance to cool down and pick up a bit of moisture. This then tempers down by the time it reaches us. Looking at 9 o'clock, this is low risk. It comes from South America, travels over the Caribbean Sea and Atlantic Ocean, so it cools down and picks up moisture, tempering it down, but it still has a sting in its tail. It hits Ireland first, so they take the brunt of it before it hits us. Looking at 11 o'clock, this is low risk. It comes from the west coast of North America and travels over the Atlantic Ocean, a large body of water. If it still has a sting in its tail, it will hit Scotland first, bearing the brunt of it. So by the time it gets to Scousland, it is relatively mild in temperature and humidity. How can I protect myself in the summer? Observing weather forecasts, weather fronts, pollen counts and air quality. During summer, there can be high temperatures, pollution, pollen count, heat and humidity, which can affect your chest. So observing the forecast will help to prepare for an increase in symptoms. The level of ozone and other air pollutants can rise in the air when there is strong sunshine, and this may cause an exacerbation of symptoms. Other pollutants such as grasses and weeds make pollen levels high. These are normally in the spring and summer months, although they can be around in autumn months. If you have hay fever and a lung condition, please avoid going out when pollen levels are high. Pollen levels are the highest early morning and early evening. Avoid opening windows at these times and use a fan to stay cool. At night, when the air is cooler, open your windows if it's safe to do so. During a heat wave, the hottest part of the day is between 11 a.m. and 3 p.m. So if you need to go out, try to plan your day around early morning and evening when the temperature is cooler. If it's cooler inside your home than outside, close the windows to keep the cool air in and draw your curtains. The use of fans is recommended. Exercising safely during hot spells. We all know the benefits of exercise, especially if you have a lung condition, but please take care during the hot weather. It's best to complete exercise, housework and gardening in early morning or early evening when it's cooler. During a very hot spell, you may want to avoid strenuous activity and engage in a lighter exercise program. If you do become breathless, apply breathing control to ease symptoms and always remember to have your reliever inhaler on your person. Always look after yourself and others, ensure you have enough medication, and if you have a change or increase in symptoms, consult with your GP. Try to walk in the shade and pace activity. Wear loose cotton clothing to try to stay cool. Wear a hat to protect your neck and head and sunglasses to protect your eyes. Preferably wrap-around sunglasses. This will protect your skin from the sun and stop pollen from entering your eyes. Wear a high-factor sunscreen to protect the skin even when the sun is not shining or in overcast conditions. And please check your respiratory medications, as some medications can make you more sensitive to sunlight. Take cool showers or baths, or place a wet flannel tea towel around your neck to help cool down the skin. During summer months, we can lose extra fluid from our skin, so stay hydrated. The recommended guidelines are 6 to 8 glasses a day. Water is best. Drinks with caffeine, such as tea, coffee, high-sugar drinks, make you more dehydrated. Fluid can also help with sputum, as this dilutes the sputum down, making it easier to clear from your chest. Eat as normal during a heat wave, as you can lose water and salt through sweating. Eat foods such as salads and fruits, as these foods are higher in water content. Keep inhalers out of direct sunlight, as high temperatures cause the inhaler to deliver less medicine than if stored at room temperature.
Preparing for the cold weather. When we breathe in cold air, this can cause our airways to narrow. You may notice a wheeze, a cough and an increase in breathlessness. If you know the cold weather does affect your chest, please take your reliever inhaler 30 minutes before going outdoors and wear a scarf loosely around your nose and mouth to help warm the air you are breathing. Always remember to have your reliever inhaler on your person. Avoid going outdoors if not necessary, but if you do venture outside, please wear a hat, gloves and an extra pair of socks. Wear thermal clothing or several layers of thin clothing rather than one bulky layer, as this will trap the warm air in between the layers, holding the heat for longer. Wear non-slip footwear. When you are outside, if you notice that you start to shiver, this is your body trying to generate heat, so please keep moving and go inside when you can. Becoming unwell during the winter. It is very good practice to always monitor your symptoms throughout the year. During the winter months, GP practices see a rise in appointments due to an exacerbation of symptoms, and there is an increase in hospital admissions. In the winter, there is an increase in respiratory infections such as seasonal flu, the common cold and chest infections such as pneumonia. These infections cause a flare-up in symptoms. Chest infections can be more severe during the cold weather, so be mindful it may take longer for your chest to recover. To avoid the risk of spreading germs, use a handkerchief, regularly wash your hands or use hand sanitizer. You might want to consider wearing a mask if in public. If you notice a rise in symptoms, avoid going out in the cold weather. Try to stay warm and drink plenty of fluid. Try to eat one warm meal a day and contact your GP promptly if you feel you are becoming unwell with a chest infection. Staying warm indoors. When indoors, please do not sit for long periods. Stay as active as you can, but always remember to pace yourself. Avoid blocking radiators with furniture to ensure good circulation of warm air. Lower your thermostat in rooms that are not in use to lower the cost. You may notice a dry heat can cause an increase to your symptoms. If so, you may want to place a small bowl of water next to the radiator to humidify the air. Use draft excluders and draw your curtains at dusk to maintain the heat. On cold nights, you might want to consider wearing thick pyjamas, as during sleep our body temperature drops. You may want to add additional blankets or hot water bottles and close bedroom windows at night. Rooms that are most in use, such as living rooms and bedrooms, we recommend heating these rooms to 18 degrees Celsius. Use a room thermometer to help you work out what temperature is most comfortable for you. Protecting yourself with vaccinations. Please consider booking an appointment with your GP approximately in the month of September to have your annual flu, pneumonia and COVID vaccinations. Other environmental air pollutants that increase symptoms. Air pollution. Air pollution is any toxins in the air that are hazardous to our health. Everyone is at risk from these toxins, but some people are more at risk than others, such as children, elderly, or those living with a long-term lung condition. Air pollutants we breathe in can get deep into the airways, causing inflammation. You may notice a wheeze, cough, or an increase in breathlessness. Air pollutants can be found on busy roads where traffic is heavy, around industrial sites and factories. Celebrations. The burning of fireworks and bonfires release a large amount of chemicals polluting the air. Breathing in smoke or chemicals like this can irritate your airways. Try watching a firework display from inside your home or on the television, or you may want to go to a drone or laser show instead. If you prefer to attend a firework display, consider wearing a mask or a scarf to act as a filter, and be mindful, smog from the fireworks can remain in the air for several hours following a display, especially if there is no wind to blow this away. And again, always have your reliever inhaler on your person. Home environment. If you have a cold, damp home, this increases the risk of getting mold. Mold is a fungus that appears in damp places and can look like black, white or green patches, often looking like a stain or discoloration to the surface. They can be velvety or fuzzy in appearance. It is very important you deal with mold quickly. For further advice about reducing the risk of damp, please refer to Liverpool Healthy Homes for advice about controlling condensation and mold. Things to avoid. Many cleaning products can contain harmful gases, so avoid using household sprays that can cause airway irritation. Instead, use cleaning products that can be diluted in water. The same also applies for toiletries. Use roll-on deodorants, perfumes and aftershaves instead of sprays. Everybody likes a nice fresh smelling home, but be mindful, when using plug-in air fresheners, this releases pollutants into the air which can cause irritation to the airways. Instead, you could opt to use a gel odour absorber or a gel freshener. This concludes our talk today.
Hope you enjoyed it. For further information, please visit the Breathe Programme website.
Bye!